Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 19 new cases of COVID-19 in Windsor and Essex County. Of the new cases, 2 are outbreak-related, 5 are close contacts of confirmed cases, 2 are community-acquired, and 10 are still being investigated. We have had 13,066 cases since March of 2020. A year ago. 12,413 cases are now resolved and 264 people are active at this time. 44 confirmed cases are currently in the hospital and 9 people are in ICU. Our community has lost 389 people to COVID. We are reporting an additional death today, a man in his 70s from the community. 237 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 12 active outbreaks in Windsor and Essex County, 6 workplace outbreaks, 2 hospital outbreaks, 2 community outbreaks, 1 retirement home, and 1 school outbreak. Currently, we have a total of 15 cohorts dismissed across 10 elementary and secondary schools from 3 school boards. Dismissals range from junior kindergarten to grade 11. These dismissals include approximately 314 students. We also have 4 daycare cohorts dismissed at this time. We have 1 school outbreak, and the outbreak is associated with a single cohort. And as per the provincial direction, a school outbreak is declared if there are 2 or more cases in a school, and if there is evidence that at least 1 case could have been infected in the school. There are currently at least 2 confirmed cases of COVID-19 in a single classroom. There are 2 other cohorts dismissed at this school that are not associated with the outbreak. We are currently in phase 1 of Ontario's 3-phase COVID-19 vaccination distribution plan. Currently, more than 6,000 Windsor-Essex County residents have received their first dose. 11,592 people have now received both doses of a COVID vaccine. Yesterday, 168 people over the age of 80 were vaccinated at our targeted community clinic at the WFCU Centre. For those of you who are over 80 years and would like to get vaccinated, please pre-register by visiting our website at wechu.org or call 519-251-4072. As of this morning, we have approximately 12,676 people who have pre-registered and are over the age of 80. Following the removal of duplicates, this number will be a little bit lower. Whether you are vaccinated or not, please continue to follow all public health measures. Stay home if you're sick. Limit your close contacts to your household members. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us. I don't have much to add today other than what Teresa talked about, some of the work that we are doing right now with the vaccine and some recent outbreaks in the school system. And we wanted to work to get the vaccines out as quickly as possible. So that's what our team is currently working on. And we'll be happy to take questions.
We'll now take questions from the media. Today we'll start with CBC.
Hi, good morning, Teresa. Good morning, Dr. Ahmed. There's new advice from the National Advisory Committee on Immunization. They say it's okay to extend the time between the first dose of a vaccine and the second to 4 months. I'm wondering what you think of that, and if it were to be allowed in Ontario, would that be a game changer here in terms of getting more people their first dose?
Well, great question. The recommendations for many of these vaccines, as we know, is provided after a careful review of all the literature and the science behind the immunization. Generally speaking, most of these vaccines, the first dose is to generate the immune response, and the second dose is generally to to extend the duration of protection. What the research so far has been showing, and with limited data, is the first dose of vaccine, with the mRNA-based vaccine, that still provides a good level of protection. The initial data showed that the level of protection could be as high as up to 92% after 14 days of their first dose. Even post research or post studies after the clinical trials is showing the effectiveness data could be anywhere between 80 to 90%. So that's a pretty significant level of protection that is provided by single dose. And when some of these decisions, the policy decisions to extend the duration of between the first dose and second dose happens, it definitely opens up more opportunities for people to receive the vaccine. And when more and more people are protected, the likelihood of transmission continues to go down significantly. And we're hoping that if the Ministry of Health in Ontario, if they adopts to the similar position, we'll have much better protection in the community. There will be more people who are vaccinated, and as a result, we'll see less of this transmission, and we'll see a much better result of providing the level of protection that all of us need.
Thank you. I'm also hearing that Windsor-Essex is one of the areas selected for a pilot project where pharmacists can administer vaccines. Do you have any details on what that might entail?
So, yes, that is something that we've been working with the ministry, and in our conversation, we are doing everything to bring more vaccine to our community. Our plan, as we present it to the community, does include the rollout using our pharmacy network. It also includes rollout of our using our primary care providers network, in addition to the mass vaccination clinic. So all of our plans and all of our work have been ongoing with the ministry, and the Windsor-Essex, based on the work and our plan, is selected as one of the sites to administer the AstraZeneca vaccine for our region. So far, what we know is that the ministry is working directly with the Pharmacists Association, and these vaccines will be going directly to the pharmacies in the region. And we don't have a set number at this time that how many of these pharmacies will be registered. There was some back and forth in terms of the number of pharmacies that can participate in the pilot, but that conversation is happening at the provincial level and not at our level. We do have a working group, and we are working closely with the Essex County Pharmacists Association, and we have done a lot of engagement with them, and their willingness, they already are responding to some of our survey, which is getting them all set up to be able to have all these policies and procedures that are needed. They are able to have some of these cold chain fridge inspection that is needed, that needs to be done. So we're working through all of those details as we speak, and I think the vaccine will start to come in maybe in a week or two. I don't know, Teresa, if you want to add more.
No, I think it is. It will move quickly, and we have been part of those initial conversations. And when they asked for pilot sites, we did express our interest in being a pilot site. So we do know that that it has been confirmed we're one of 3 pilot sites in Ontario right now.
Thank you.
Any questions from Blackburn?
Just further to that, do you know if they'll be sticking to like a certain age group, or will it just kind of be appointment-based with the AstraZeneca at the pharmacy?
So there's been some conversation around that on what the specific target population should be, and I'm not sure that if we have landed to one particular group. I haven't seen a set policy from the province. So I'll be careful what I say, but knowing that AstraZeneca is approved or recommended for individuals who are 65 years and under, so that probably would be the target group. And the best way to go through some of these lists is sometimes just use the age as a criteria to start booking people and get those vaccines out as quickly as possible. So I'm anticipating that it would be an age-based criteria to make it easy for scheduling and getting people in to get the vaccines out as quickly as possible. We recognize that there's a large number of shipment coming in, and there will be more vaccine, and we really want our community to use that opportunity to get a vaccine. And despite some of these questions and concerns about which vaccine should be the best one or which one I should get, all these vaccines are pretty effective, and you need the level of protection. So what the vaccine, if you're getting an opportunity to get the vaccine, get it to keep yourself protected and bring the level of protection to our community.
Okay, and on another topic, the long-term care home that recently has been declared an outbreak, 3 residents, do you know or can you say if these residents had been vaccinated or not?
So without getting into any personal health information, I can say only one piece, that no, they were not vaccinated. And but again, this is an evolving situation right now, and it's very contained. But because of the fact that it is the transmission happened in that setting, an outbreak declaration has been made. That's all I can say.
But I guess this could be, a true test if some of those residents have been vaccinated to see how far this could potentially spread, or if it doesn't spread. I mean, would that be, something you're watching closely?
Absolutely, and I think that's what we are seeing. And knock on wood, our number of cases in the long-term care home and retirement home have dropped since we vaccinated all of these people. So we hope that despite the transmission in this very small group of people that happen, it shouldn't extend further, and we want to provide the same level of protection to all the long-term care home and retirement home in the region. And we have done a really good job in vaccinating all the residents, and I'm aware that a significant majority of the healthcare worker and essential caregivers are also vaccinated. There were some people who didn't get the vaccine out of their own choice, and hoping that they will all use this opportunity to get the vaccine as quickly as possible to keep those high-risk vulnerable population as safe as possible.
Thank you.
Any questions from the Windsor Star?
Good morning, Dr. Ahmed. Just to clarify some details, the pilot project with the vaccines at the pharmacies, when do you expect that to begin?
Within a week or two max. I think what I remember, it was the target date was March 15th, but it may be sooner than that if everything else is in place.
And it's the AstraZeneca vaccine that's arriving?
That's the initial conversation. We'll see if it evolves into further something different, but the plan is for AstraZeneca at this time.
How many pharmacies will be involved, and are they of a specific franchise or chain?
No, I think it would be open to all the pharmacies, whoever participated in the universal influenza vaccination program, and their ability and their willingness to administer the vaccine. Obviously, it does require some criteria to make sure that they have some of the other policies and procedures, access to COVAX, ability to schedule people, bring them in and vaccinate with the numbers that the ministry is looking for. And I don't recall if there's any cap to it. My guess is anyone who is willing and interested, they will be selected, and if they meet the criteria set out by the ministry.
How significant is this in the vaccination efforts in our region?
It is pretty significant, as we said, that we want to use all the existing channels. We want to bring more and more vaccine for our community, and recognizing that the supply challenges with some of the other vaccines, such as AstraZeneca and Moderna, we have already seen that. Despite our ability to vaccinate more people, we are not getting enough supply to roll it out as quickly as possible. So what we are seeing that this is an additional number of this is an additional dose. These are all additional doses of vaccine that are coming to our region, which is a good news. That means more protection, more vaccine for our community, and we really want people to use that opportunity to get vaccinated.
Moving on to a different subject, yesterday the Ministry of Labor announced new hires in their provincial offenses officers regarding COVID safety, and that a campaign was coming to Windsor on Saturday focusing on small businesses. What do you know about this enforcement campaign?
So as always, our team participates in these enforcement campaigns, and we always get in touch with our partners at the ministry in doing these joint enforcement campaigns, and we can share more details tomorrow what that campaign looks like. But we are always involved in the initial discussion, as well as locally, that how the campaign will be launched and how it will roll out in the community. So we are aware of it, but we were planning to share those details tomorrow.
Forgive me if you want to wait until tomorrow, but just if you're able to answer, why focus on small businesses?
Well, I think the initial focus of the campaign was on the big box stores more recently, last time. And while I can't comment specifically that why they're choosing one versus the other, but I think when we're talking about the enforcement, it has to be across the board and should be focused on ensuring the safety. It's not about big or small businesses. I think it's more about making sure that our businesses in the community are safe, and are they providing the level of service that everyone deserves. And I'll pass it on to Teresa to maybe add a little bit more.
So I'm just looking at our notes for tomorrow, so we'll just kind of, say it today. But so it's the higher risk businesses that, such as personal service settings, restaurants, bars, and larger retail stores that'll be prioritized by the group that we're working with for the coming weekend.
Thank you.
Any questions from AM 800?
Teresa, you mentioned the outbreaks at the schools right now, or the cases, excuse me, and then the one outbreak declared. The numbers that we're seeing at schools, how do they line up with what we saw in end of November and December?
Yeah, I don't have that in front of me, but the numbers are that's significant, having that many students dismissed right now. So in the EPI summary tomorrow, I think we should have a look at that and see if we can compare that. But at this time, I don't have that direct comparison.
So the only thing.
Okay, and then one quick one here in regards to yesterday's numbers. Kind of going back to Maureen's question, I know it was for a short period of time, but at one point there was zero outbreaks at long-term care and retirement homes. I know it's been a difficult struggle the past couple of months. We haven't seen that in quite some time. I know it was for a short time, but how did you and the team feel to see zero, even though it was just for a short period of time?
So I'll start, and then maybe if Teresa will want to add. I think in the last week or so, every time when my team was bringing in that we're rescinding outbreak in these facilities, every time they bring in those recommendations, we always took that as like a great excitement and joy to say, yep, okay, one more down, and how many more to go. So that was the kind of approach that we have taken, and it's really good to be in that place where we are able to confidently say that we're no longer seeing any transmission or a higher risk in our long-term care home and retirement home. That was our goal, like all the way from December when we started seeing the cases piling up, people dying, and with the news of the vaccine, it was depressing at time. And I know me and Teresa, we had this conversation many times, and the only motivating factor at that time is how quickly can we get out these vaccines to provide the level of protection to these people. And so we are able to achieve that. So it was really big. And while I kind of explained without getting into the personal health information piece, the facility is in an outbreak, but it's still fairly contained, and our hope is it would not result in any further transmission, and that means overall, from a level of protection perspective, it will be a good news for our community. But just because the transmission happened in that setting, it meets the criteria for the outbreak. So we're monitoring it closely. There is a risk, but we are hoping that that risk doesn't translate into something bigger. But we were really excited about it, and I'll pass it on to Teresa to maybe share her thoughts.
No, absolutely. Just every time a home was rescinded, or something was concluded after a lot of effort on the part of the home and all of the supporting staff from our health unit and different agencies, it's always a good feeling. And everything changes so quickly, though, and so the focus right now, while the numbers are lower in other areas, as was shared today, we do have a lot of activity going on in the schools. So our nurses and our staff are working very closely with all the school boards, and there's always good successes, and then there's other things that need to still require a lot of attention. So any good news is always welcomed, but there's lots of work to be done, and we've just started with the vaccine rollout, but it is, almost 500 people have been vaccinated, over 80 just at the WFCU center. So those are good things in our community, and they will help prevent severe disease and death from COVID. So that's our goal, and we're slowly seeing some, small successes.
Thank you. One final question for Dr. Ahmed. Dr. Ahmed, I know tomorrow you give the summary, but just looking at our numbers this week, are you anticipating us shifting to orange zone, or do you think we'll still be in red zone next week?
So I'll say this with caution. I haven't had any conversation with the ministry, and generally when I don't have this conversation, that means that the data that they're looking at, it's probably it doesn't meet their criteria to have a dialogue or to understand what's going on. We have seen some good data this week, but we have also seen cases in the 30s too. And just by sheer number, if I can explain that, anytime on a daily basis, if you're seeing cases more than 23, that means we will end up in the red zone. So on an average, if you're seeing cases 24, 25 every day, we will end up in red zone. If you're seeing cases on an average less than 23, so for example, if you're seeing cases in the 20, on an average, just 20 cases every day, we can be in the orange zone. So that's the kind of a rough marker. So we have seen both sides this week, and when we analyze all that data for tomorrow, we'll be in a much better position to share what the community picture looks like. But since I haven't had any conversation with the ministry this week, I'm not sure that if there's any indication that we will move to orange tomorrow, or the announcement will be made tomorrow.
Thank you.
Any questions from CTV?
Yes, good morning. Do you expect to see this number in schools, given that they've been open for a month, the classrooms, or is this kind of surprising to you?
Well, I think kind of expected, because the new guidance from the ministry based on the variant of concern is very strict, and it does put more, it sets a lower threshold for the investigation and class dismissals, even when we don't have any variant of concern, because at the time when we get a positive test, we may not have the result for any possible variant of concern. So many of these guidelines are designed intentionally to err on the side of caution, resulting in more dismissal. So that's what I think we're looking at, that when we have the cases, there are more dismissals that are happening. And overall, when we're looking at the actual cases in the school, that number is still relatively, stable compared to what we have seen in November and December. And to Rob's question earlier on, when we're talking about what the situation was in November, December in the school versus what the situation is right now in the school, I think there's more dismissal, but in terms of the actual number of cases, it's not the same as we have seen in November and December.
And with all the protocols in place, is there anything else that could be done?
Well, I think I'll start, and maybe Teresa will add. So some of the things that obviously these protocols are designed and developed based on the best possible evidences and everything. But at the end of the day, we're all human beings and we have to follow those protocols. So even if we have those protocols and people are not following them as they should, there will be some lapses. And everything that we learn, we implement. So making sure that we are not waiting for something to happen before we make some of those implementations. So our team is constantly working with the school board. We're working with the ministry to make sure that, we're bringing in all the evidences to support the community. Teresa, you wanted to add?
Just to add that some of the cases in the schools that we're dealing with in the dismissals is that people are attending while they have a symptom. So again, going back to the public health guidance, and if you have any symptoms, even mild ones, stay home. Stay home if you're sick. So I guess that would be one of the messages that we would like to enforce is that, students and staff, everybody, that if you're sick, stay home. No matter, what symptom you have, if it could be a COVID-related symptom, you need to stay at home and not attend school or workplaces.
Okay, thank you. And just on the contact tracing, I think yesterday was the first day that there were no cases under investigation. Is the health unit having a much easier time now? I guess the case counts are lower, keeping up with all the contact tracing.
So we are able to manage the lower numbers. So what we're doing internally is just reassigning people to vaccines. So as we see a little bit of relief in one area, we're ramping up another area. So you're correct. Even removing some of the nursing staff to, be seconded to another area of priority, things are going well with the case and contact management piece.
Great, thank you.
Any further questions from CBC?
Yes, I have two more quick ones. I know we have the figure for the number of people who have received their shots and have been fully immunized, but is there a number available for how many doses that our region has received to date?
We don't have that number that we report on, but we receive our weekly supply, and we'll just have to add all those numbers up to give you the total doses. But generally speaking, we don't hold many of these doses back other than what is logistically needed to make sure that we continue on with our booking and with our clinics. Combination of the hospital and our clinic, we are utilizing all the doses that are coming our way, with the exception of making sure that the logistics of continuing to vaccinate every day is there and utilize them all as quickly as possible. We just have to add those numbers up. All I can tell you that we may have, I think at the end of the week, when we are supposed to get the additional supply, we typically have close to between 800 to 1,000 doses, just to compensate for the few additional doses if there's any last minute anticipated delays or something. But other than that, we utilize all the doses that are coming our way.
Okay, thank you. And a question about the vaccine rollout at the targeted clinics. Can people who are selected for appointments bring their spouses to get vaccinated if they're also older than 80? Is that something that the health unit is considering doing, allowing, I guess?
So great question, and I think we have heard from our community members. We are definitely looking into it. It's just trying to balance the I guess the ethics and also the logistics of how we would do it, and what kind of impact, or maybe it would be good for some. It could be it may provide them with more opportunity to vaccine to be in the list of getting selected. So we are looking into some of those logistics, but definitely we want to provide more patient-centered care. And I've had a number of conversations yesterday with my team members, and to see how we can operationalize it. And if possible, we would like to do that, but at this time, I cannot commit to when we will start, but we are hoping that we can get to that point as logistically, ethically, and operationally possible.
Thank you.
Any further questions from Blackburn?
No, thank you.
Any further questions from the Windsor Star?
Nothing further, thank you.
Anything further from AMA 100?
No, thank you.
Any additional questions from CTV?
No, thank you.
Thank you, everyone.
Thank you.